Good morning, Hensi Russworth. I am Mihiraa. Let's begin warm-up session. What qualities do you believe are essential for a successful doctor-patient relationship?
Compassion, empathy, effective communication, and respect are paramount for building trust and rapport with patients. By actively listening to patients' concerns, demonstrating empathy, and involving them in decision-making, we can cultivate strong doctor-patient relationships conducive to optimal healthcare outcomes.
How do you prioritize patient safety and quality of care in your practice?
Patient safety and quality of care are my top priorities. I adhere strictly to evidence-based practices, follow clinical guidelines rigorously, and regularly review outcomes to identify areas for improvement. I also foster a culture of open communication and encourage the reporting of safety concerns to ensure continuous enhancement of patient care standards.
Can you discuss a time when you had to deliver difficult news to a patient or their family?
Delivering difficult news requires sensitivity, empathy, and clear communication. I recall a situation where I had to discuss a serious diagnosis with a patient and their family. I approached the conversation with compassion, provided support, and ensured they understood the diagnosis and treatment options. By offering ongoing support and resources, I helped them navigate the challenging journey ahead.
How do you handle conflicts or disagreements with colleagues in a professional setting?
Conflict resolution is essential for maintaining a cohesive healthcare team and delivering quality patient care. I believe in addressing conflicts promptly and respectfully, focusing on constructive dialogue and finding common ground. By listening actively, expressing concerns diplomatically, and seeking collaborative solutions, I strive to resolve conflicts effectively, while preserving professional relationships.
In what ways do you promote patient education and empowerment in your practice?
Patient education is crucial for promoting informed decision-making and empowering patients to actively participate in their care. I incorporate education into every patient encounter, explaining medical conditions, treatment options, and preventive measures in clear and accessible language. I also provide educational materials, encourage questions, and involve patients in shared decision-making to empower them to take control of their health.
You can now start your OET roleplay.
Good morning, I am Dr. Hency Russworth. What brings you here today?
Good morning, doctor. Honestly, I've been feeling quite unwell lately.
I'm sorry to hear that. Well, how may I address you?
You can call me Mihiraa.
Mihiraa, can you tell me more about what's been bothering you?
Well, it all started about 2 weeks ago when I went hiking with my friends. We found a beautiful water hole and went swimming there. Since then, I've been having stomach cramps, nausea, diarrhea, and feeling dizzy.
I see. It sounds like you've been through quite a lot. Did you happen to swallow any water while you were swimming?
Yes, I did swallow some water while swimming. I didn't think much of it at the time, but now I'm starting to wonder if that's what's causing all these symptoms.
It's possible. Swallowing contaminated water can introduce harmful microorganisms into your system, causing the symptoms you're experiencing.
Contaminated? With what exactly?
I understand your concern, Mihiraa. When we talk about contaminants in water, we're referring to various substances that shouldn't be present and can potentially harm your health. These contaminants can include microorganisms like bacteria and viruses, which can originate from animal or human waste. It's essential to be cautious because exposure to these contaminants can lead to a range of health issues, including gastrointestinal infections, like the ones you're experiencing.
That sounds serious. Is there a way to confirm if that's what's causing my sickness?
Absolutely, Mihiraa. Your concern is completely understandable, and it's essential to identify the root cause of your symptoms, to provide you with the best care. We can start by collecting a stool sample to examine under a microscope. This will allow us to look for any abnormal findings, such as the presence of harmful microorganisms or parasites. Additionally, we may conduct culture and sensitivity tests to identify any specific bacteria that could be causing your symptoms. Furthermore, we'll also screen for parasites, ova, and cysts, as these can indicate certain types of infections. And given the nature of your symptoms, we'll include a test for norovirus, which is a common culprit behind gastrointestinal issues like yours. I understand that undergoing these tests may feel overwhelming, but please know that they're crucial steps in pinpointing the cause of your sickness, so we can tailor the treatment accordingly.
Okay, that makes sense. But what about my symptoms now? Can I get some treatment to help me feel better?
I completely understand your urgency to feel better, Mihiraa. Right now, our priority is to alleviate your discomfort while we await the results of the tests. I'll prescribe some symptomatic treatment to help manage your symptoms. For example, I'll provide you with antiemetics to help ease the nausea you've been experiencing. These medications should offer you some relief in the meantime. It's essential to wait until we have a clearer picture of the underlying cause of your sickness before starting any specific treatment. Once we have the results, we can tailor the treatment plan to address the root cause effectively.
But what about anti-diarrheal agents? I've been having diarrhea for 2 weeks now, and it's really affecting my daily life.
Mihiraa, I understand how challenging it must be to deal with diarrhea for such an extended period, especially when it's interfering with your daily activities. While I empathize with your discomfort, it's crucial to proceed with caution. Given the symptoms you've described, and the potential exposure to contaminated water, it's essential to rule out any infective causes, such as bacterial or viral infections, before considering antidiarrheal agents. These medications can sometimes mask underlying infections, making it harder for us to diagnose and treat the root cause effectively. I know it's not the immediate relief you were hoping for, but please trust that by following this approach, we're prioritizing your long-term health and well-being. In the meantime, I'll provide you with supportive care to help manage your symptoms as best as possible. Once we have the test results, we can reassess the situation and adjust the treatment plan accordingly.
I guess you're right. I'll trust your judgment, doctor.
Thank you, Mihiraa. In the meantime, it's crucial to keep yourself hydrated, especially with ongoing diarrhea. Drink plenty of fluids like water, broths, and oral rehydration solutions to prevent dehydration. Your well-being is my priority, so please ensure you stay hydrated. If you have any concerns, let me know.
Thank you, doctor. I appreciate your help and guidance.